Welcome to Medical Mondays, a once-a-month medical series that I, as a physician, feel like it's important for cruisers to know. So, one Monday per month, we deal with a medical concern or a topic that I feel is important for you to know, whether you live on the boat full-time and travel, or you are on it for 6 months of the year, whatever it is. You've got chronic medical issues, whatever it is, and today we are dealing with an important topic, one of medications. Liquids, solids, pills, whatever form they come in. It's really, really overwhelming, I feel, for some people because they don't know how much to have. Should I have a giant bottle of, ibuprofen, or should I just have a little travel pack of it? Well, if all cases, it depends. It depends on your cruising schedule. And if you haven't seen our episode on our medical kit, you definitely should, because that talks a lot about how you should even make a medical kit and how you should have your medical kit. I've emptied out our medications from our medications box. They are usually pretty well organized in there. We also have an idea of how much we have, when their expiration dates are, and what we should be refilling. So even we made some small mistakes when we were doing our medical box that we have fixed as we went along, so come along the journey with us. Just like when you're putting together your medical box, I think when you are putting together your medication box, it's really hard to figure out how to categorize it. So do I categorize by symptom, or do I categorize by body part? Do I categorize by systems of that doctors use, for example, the endocrine system, the lymphatic system, the respiratory system, the, neurological systems, which, it depends on the person's brain and how they like to organize things in their head. Whatever it is, do you. We're going to go over how we organize it, so let's jump right in. The very first set of medications we're going to talk about kind of deal with pain. So whether that's a headache, whether that's, I shoved my hand into a fan and now it hurts, I jammed my finger, whatever it is, I feel that pain is a everyday feel in the boat. It is just part of who we are as sailors, is that we're also a little bit in pain in something we stubbed our toe on every day. The two big players in the pain department are ibuprofen and acetaminophen. So we're going to be using drug names and not their brand names, because it depends on part of the world that you're from on what the brand name is. And we'll put it at the bottom so that you know the word that I'm saying, because I might be pronouncing it differently than where you're from. When do you use ibuprofen? So ibuprofen is really, really good for pain, of course, and it is good for fever reduction. It is also really good for when the pain is associated with some sort of inflammation. So if you've got something that is swollen or inflamed, then ibuprofen is really good because it is an anti-inflammatory. So it is a non-steroid anti-inflammatory. So it is not a steroid, but it reduces inflammation. Tylenol or acetaminophen. Really good for pain, again, really good for fever reduction. The only thing is that it does not allow for inflammation, so it's not a anti-inflammatory medication. You can take this every 6 hours. It's rough on your liver, so just be very careful about the dosage. Pediatric doses are very different than adult doses. Pediatric doses are done by weight, so you should know your child's weight in kilograms, which is 1 kilogram is 2.2 pounds, and so always sort of have a rough idea on how much your child weighs, because this one, I believe, is 15 milligrams per kilogram per dose, given every 6 hours. So be very careful. Read the full list of side effects. You can overdose on this. You can end up in the hospital with this. So just be very, very careful with Tylenol, but it is not addictive, and it is a great pain reducer, pain and fever reducer. And you're going to see a lot of extra strength and da-da-da-da. Always just look at the milligrams. So branding is a great thing. They'll say, this Tylenol is made for women in pain. This is made for, that arthritic pain. But if you look at the ingredients and the actual dosage, that's the most important thing, because a lot of times they're all the same thing. This is a 500 milligram tablet. So for adults, on average, you can take somewhere between 500 and 1,000 milligrams, which is 1 or 2 tablets every 6 hours for pain and fever reduction. Just to get back to ibuprofen for a second, so you can take this every 4 hours, which is really good because you can take it more often, but it can be very, very rough on your stomach, so it can cause stomach ulcers, or it can make stress ulcers much worse. So always have this with food. Be really, really careful when it comes to your stomach with this. Lots of water and lots of food. And again, pediatric doses. Kids are not mini adults. So pediatric doses, I believe for ibuprofen, is 10 milligrams per kilogram per dose, given every 4 hours. So know your child's weight and make sure you're giving them the correct amount. These both do come in liquid forms. So for kids, it's a lot easier. And look at the strength of them. So like I said, Tylenol, this tablet was 500 milligrams no matter what, but you can have 2 different liquid suspensions and they could be different strengths. So be very careful when you're giving your children these medications, because it is very easy to overdose them and they will end up in the hospital either way for either of these drugs. So just be very, very, very careful. The last pain medication, pain management medication that we have on the boat is actually something that we don't really use for pain. I go to acetaminophen or ibuprofen if I need it. We have an 81 milligram, what's called baby aspirin bottle on board. It is really for treatment of a heart attack that I keep on board, because paranoia of a physician, you always think that you're going to, be in an elevator and the woman's going to give birth, or be on a plane and someone's going to have a heart attack, and you don't feel like you're prepared. So we have this honestly in case of a heart attack emergency, because studies have shown that early giving aspirin, baby aspirin especially, early in a heart attack really helps the recovery process. But that's kind of a complicated topic that we can go on in another video if you are interested in dealing with a heart attack, what to do if someone near you has a heart attack. I would love to make a video of that if you're interested, so leave a comment below if you are. But I would overall suggest, if you are just the kind of person who has a headache once in a while, or migraines, or stubs their toe or hits their head on the boom, as I do too often, just keep ibuprofen or Tylenol on board. Aspirin is an anti-inflammatory. It is great for pain, but it also thins the blood, so it's a blood thinner. It can have something called Ray's syndrome, which is this funny little reaction syndrome you get if you're having flu-like symptoms and you take aspirin. Look that up. It's weird, but aspirin is complicated. So if you're just a typical person who just wants some pain medication once in a while, I would stick with the 2 bigger guns. Unless you have some sort of allergy, then talk to your doctor and have the right medication on board. You might even have some aspirin on board if you're somebody who's had a heart attack in the past and needs a blood thinner for some reason. But that's story for another time, maybe. And those are the pain medications we have on board. All right, we're done with the pain part of things, so we'll move on to what I will lovingly, oh, you don't belong here, that belongs elsewhere, what I lovingly call the tummy issues portion of the day. The tummy issues you can have are, something as simple as a little bit of food poisoning or stomach ache, constipation, diarrhea. You can have indigestion and such, and the basic things that we have on board for that is, one is what's called Pepcid Complete. So it actually has 3 different medications. Of course, you have to make sure that you're not allergic to any of them before you take them. Famotidine, calcium, and magnesium. I feel that this is a good combination to have when you kind of want to deal with indigestion or acid reflux all together. And so if you're having a lot of stomach pain and you think it is because of indigestion and you're getting a lot of reflux, this I think relieves the pain quite a bit. And of course, with stomach problems, it can be anything from a simple, I ate too much of one thing, to appendicitis. And it depends on which part of your stomach hurts, and it could mean a different thing. So if you are 100% sure of what's wrong, great. treat it with the right medications. But if you're not 100% sure, get on the VHF, get on your email, and just email your medical provider or somebody that you know. You can email me and say, you know, this is the issue that I'm having. You know, what do you think? And get a second opinion to make sure, or get yourself off the boat if you're at land and just go see a doctor so that they can do a physical exam on you, because it really depends on your full list of symptoms on what's wrong. But these are for sort of everyday issues. So we call it, in the US, it's called Pepcid, so it may be different things, but if you have the list of medications, that's what we have. So in the US, it's called Dulcolax. It is a Docusate. It is a stool softener, so if you have constipation, this is really good to use for stool softening. Again, check the dose. Make sure that you're taking the right dose. The furtherment of that, and sort of in the same family, kind of, is Senna, so which is a laxative. So again, if you are blocked up and you need to go and you can stay on the boat for a few days and you have plenty of water for bathroom time, take your laxative. You know, both of these medications are really great, but a big thing that a lot of people complain about are really bad stomach cramps and stomach pain, and so I'd be very careful. Be very careful taking this in combination, just like any other medications, but something like ibuprofen, where it can cause stomach ulcers, and now you've got stomach pain and stomach... It's a mess. So just know that the side effect of these, most commonly, is really pretty intense cramping, because your GI system is just being forced to move. The stool softener is a little more, less rough on your stomach. In the US, it's called Miralax, so it is polyethylene glycol. This is also really good. It's basically, in layman's terms, fake fiber that you mix into some water and that you can have if you are not quite at the I'm all blocked up stage and you just need to soften your stool a little bit. So on the other end, if you have too much diarrhea, usually it is a sign that you've eaten something that your body is trying to get rid of pretty extensively, but especially in children and in some adults, if it is so bad that it is severely dehydrating you and you can't keep up with the losses, there is a way to slow down, the diarrhea, and it's called Imodium, and it just helps sort of slow down the diarrhea, but understand that it, for some people, can make you go to the other direction. So just be careful in using it. And it really is, if it's not just for, you know, I had food poisoning and I had a day or two of, you know, really bad times and then I'll be fine. But it is when you are losing so much fluid through the diarrhea that you think you're going to be in danger. And that's when Imodium comes in handy. So that's the last one. Oh, no, it's not. I forgot. Okay, so tummy issues, and then you've got GI issues, and then you've got bottom issues. So we thankfully never needed to use it, but something that I've always kept on hand is some hemorrhoid cream. Just have it. If you don't understand what hemorrhoids are, you can get them when you have chronic constipation. You can get them if you're spending a little too much time in the bathroom, usually because of constipation, and you have hurt your bottom area. Have some hemorrhoid cream. It'll make your life a little bit easier on the boat, a little bit more comfortable. And that is the end of the tummy section of things. Related to the tummy, but going upwards, seasickness. So we can do an entire episode about seasickness. If that's something that, motion sickness or seasickness, if that's something that you're interested in, again, put it down in the comment section. I might just do that one anyway, but what to do when you are seasick. There are tons and tons of medications out there. There are tons of glasses and this, that, and the other. And if you've seen some of our videos, you know we've tried a few of them, and some of them are just bad. They don't work, and some of them work like a charm. But medications-wise, what we have on the boat are, and this is good, actually. I have, let's move away the tummy stuff. I have a brand and a non-brand version. and you see that they look different. So this is something else. That's why it's so important to know the name of the actual drug when you're traveling, because you are much more understanding of what it is that you actually need and the milligrams of it. So we use, for our seasickness, we use Meclizine. So in some countries, the company that makes it is called Bonine, and in other places it's just listed as Meclizine. They are usually chewable tablets. They are usually about 25 milligrams. They are wonderful. They not only protect, so about half an hour before you think you're going to be seasick, so you know that a heart passage is coming up, and so you're like, I know it's going to be a bad time. Well, half an hour before, or you're going on one of those speedboats. Half an hour before you go, you can take this with food, and it will work for 4 hours. The other really great thing about it is it'll work even after you're seasick. So if you're now already throwing up, you can take this, chew on it and take it, take some ginger ale with it, relax, and this will work for preventing and treating seasickness. So we had tons of these on the boat because on rough seas, even though we live on the boat, we still get seasick. So this is my most important thing. Oh, the best thing about Meclizine versus something that you've heard called Dramamine is that this doesn't make you sleepy. So the Meclizine is a different generation of anti-nausea medication, and so they do not have the side effect of making you sleepy, which is really, really good, because if you're on shifts, you don't want a medication that makes you drowsy. You just want one that treats your seasickness. So that is seasickness. A very quick note on allergies. So you can have something like you get a bit by a mosquito or a no-see-um and you get swelling and severe itchiness, and Dave is very notorious for that. He doesn't get anything less than 50 bites a day when we're anywhere near no-see-um or mosquito country. So we need to keep quite a few things on the boat that reduce itchiness, that reduce inflammation from hives, and itchiness in general. The other thing is you can have something as extreme as anaphylaxis, which is basically when you have such a severe allergic reaction that you have trouble breathing, you can stop breathing, you can pass out, you can pass away from having an allergic reaction. That is the other extreme, and that, have a epinephrine pen, they call it. So in the US, it's not really possible to get epinephrine by yourself, so you need a prescription. So understand what your country's laws are, but get an EpiPen, as they call it. We can do an entire episode on severe allergies and how to use an EpiPen, but there are plenty of YouTube videos out there. We'll put a few links down underneath on how to use an EpiPen and what to do and how to know that somebody's about to have an anaphylactic reaction that you need to immediately get an EpiPen. We thankfully don't have any reactions like that, although I would like to get one on the boat just for other people. What we have is stop the itch. So we've got two things for that, and actually we also have aloe, which is helpful, but calamine lotion, so it is a topical US suspension. I think this is a worldwide thing. It's terrible looking. It just, especially for people who have darker skin, you just look like a ghost. But calamine lotion is wonderful to stopping from itching. You can also go something stronger like Benadryl. So Benadryl we have both in pill form and in cream form. Be very careful with cream forms, because anything that comes in a pill form means that you can overdose on it. There is a limit to how much you can take. And truth is, it's not very easy to know that you've used too much of this. So there have been stories in the decades past where somebody has used too much of something with Benadryl or with aspirin cream. They emptied a bottle a day for muscle ache and they passed away from, they got poisoning of it. So just be very careful when you use creams that have medications in them, because there's no way to control how much you are putting on your body. Pills just work just as well. They go into your system and they stop the itching. Just be careful with Benadryl. It has a very long list of side effects. Not all of them are understood very carefully. It's a very, very strong medication. It's like, strange thing is, kids who take Benadryl tend to have really bad nightmares. I actually know an adult who has the same idea. So just be very, very careful. And it's very strong, and of course it makes you really drowsy. So if you're super, super itchy but you need to drive or you need to be on shift, be very careful when you're using Benadryl. For non-sleepy issues, we use, well, it's called Allegra in the US, but it's fexofenadine. We have the 24-hour one where you take one and it's good for 24 hours. It doesn't make you drowsy and it helps with itchiness and seasonal allergies and all those things. So very, very, very helpful when it comes to the very itchy days. Okay, and all of these, so as you can tell, what we have the most of when it comes to medications is when we have a simple cold. We have Halts for coughing. We've got Dayquil and NyQuil, and this is actually a really perfect example of when you can easily overdose and not realize you're overdosing. So let's say that you have a fever and you're also not feeling great. You have got a really bad cold, you're all stuffed up, you've got a fever, and you say, I'm going to pass out for the night and I'm going to take some NyQuil and it'll be great. This NyQuil is a company in the US. But if you look at what's in there, right, and then you say, you know what, I'm going to take some Tylenol because there's no real inflammation and I have Tylenol, that's what I have. So you take 2 of these because you're an adult, and you take, it says take like however much, like a cupful, right? Now, the problem is, if you look at the ingredients for NyQuil, NyQuil has acetaminophen, and because it's the first one on the list, you know that it is the main active ingredient in NyQuil, doxylamine succinate, and dextromethorphan. So what are all of these medications? Well, dextromethorphan is a nasal decongestant, and it tends to make you very sleepy, and that's why it's in NyQuil. Sometimes I wonder if it's also in Dayquil. It's also in Dayquil. So, you just took Tylenol, you just took acetaminophen twice. This is why you need to be careful of combo medications, the one-shot wonder, because you're tired, you realize you have a fever, so you're like, oh, I should take some, acetaminophen, and then, half an hour later, you're saying, oh, I should take some NyQuil to have a good night's sleep. So just be very, very, very careful in combo medications. We are very well aware, and also we got these at a time when we couldn't access our Tylenol, so we have these on the boat, but honestly, we rarely use them, but they're good to have, as long as you understand of what you're taking. Always treat your symptoms, is, I guess what I'm trying to say, is when you've got groupings of these things, it makes life easier, and so you tend to have it, especially if you have kids. You say, I can just give you one thing, you're not going to take 3 different things. I completely understand. Do you get your kid treated the best way? But ideally, you want to treat your symptoms. So if you're going to bed and you've got, really bad headache, a fever, and nasal congestion, well, you can take something like Tylenol or acetaminophen or ibuprofen, and then you can also take a nasal congestant. And just have a little, if you have access to the internet, just make sure that what you're taking doesn't react together. But a nasal congestant, it depends. It depends on the country, what's legal and what's not legal. But a simple nasal decongestant is going to help you feel much better and sleep better, and it doesn't have the added effect of forcing you to fall asleep or make you drowsy, like these medications might. And they'll have a lot less list of side effects that you have to keep in mind when you take it. So, for example, another medication that we take is phenylephrine. So this is pseudoephedrine, phenylephrine. All of these things are different names for decongestion. So just be careful of what's available in your country and what you can take. The other one that I want to have a little bit of a cautionary thing for is things that make you cough. So, or things that make you cough and things that make you stop coughing. So those are 2 very, very different things. So things that make you cough are called expectorants, which means that they make you expectorate, which is spitting things up or, coughing things out. And things that are cough suppressors. Children, for the most part, don't use either. I know it's a very, very big thing to say, but studies have shown that most kids who have a healthy pulmonary system, like healthy lungs, and most kids do have pretty healthy lungs, unless they've got another chronic medical issue, they can get rid of things and they can keep themselves from coughing just fine without any medication help. Forcing the cough sometimes can cause damage to the lungs. Not letting a kid cough, I know that it sounds terrible, but not letting a kid cough can get stuff stuck in there longer, so they'll stay sicker longer. So be very, very careful using cough medication of any kind in children. For me, 99% of the time, it's a no. It's something else. Go take a steam bath. Put some Vicks on their chest and stuff. Help them decongestion. You can have a little thing that gives them some steamed air. You can, especially if your child is an asthmatic or when they get sick, their lungs kind of tighten up and spasm. You can have inhalers ready for them that are prescribed by their doctors. We have some steroidal and some non-steroidal inhalers, mainly because we have a history of it. After we had COVID a few years ago, our lungs get very, very funky. Also, in adults, depending on if you've smoked and if you've done other things that are not great, your lungs may not be in perfect condition, and so you may need either the cough suppressant or something that makes you cough things up. But again, if you give somebody something that makes them cough hard, you can hurt their lungs. If you give somebody cough suppressant and they want to get rid of stuff, they can't. They slept a little better at night, but they now didn't cough up the stuff they were supposed to overnight. So just be very, very, very careful. We have some, I think we've used it once when all of our symptoms were gone and we only had cough left, and we just needed to give it a little bit of a break. But to be honest with you, it's just one of those things that we bought once and it just kind of stayed in the medication kit. We try very hard not to use it. I hope that has helped you in understanding what medications we have on board and really notice of what medications we don't. So if you watched any of our previous videos, you know that I harp on antibiotics and having antibiotics on board. Truth be told, there are very, very few cruising plans that require you to have antibiotics on board. You should treat the right bug with the right drug. So if you feel like you have an infection, get thee to a doctor. Make sure that you are getting the right antibiotic for the right drug. There's a lot of unnecessary use of antibiotics in the world that are creating superbugs, that are creating super resistances, and it is a big issue. So just be very careful when you throw that into your medical kit, because you should really know what you're treating before you treat it. Having said that, if you are, let's say, doing a big passage and you are somebody who is sort of prone to getting UTIs, urinary tract infections, or you're prone to getting some sort of antibiotic-related treated issue, talk to your physician. They know the bugs that you've had before and what resistances you might have developed, and just for that passage, they can give you one or two, packets of the medication you need. But do not get medical kits that have antibiotics already kind of in them, just sort of these generic Cipro or whatever it is, because you are creating large resistances in your body if you're randomly taking antibiotics without a doctor seeing you. So I'm going to rant on this until all extraneous use of antibiotics is done. Thank you so much for being here, listening to this. I hope this helped you. If you have questions, please post them in the comment section. We will absolutely answer them. If there is something that you want to see more of, comment below. If you liked it and have some constructive criticism, you are welcome to it. We only allow lots and lots of love here. So we will see you next month, hopefully with a new topic and some new medical thoughts.